Ephraim Dlalose is one of over 9,500 offenders doing time at the Johannesburg Correctional Centre, commonly known as Sun City. He welcomes government's move to screen them for symptoms of COVID-19, but like many others, he's worried.
There's a problem, this thing of high population in prison. To maintain a social distance, it's something that is impossible in prison. I've been here for 17 years. They did everything that they can, the official. They support us using all the resources that I have. But it seems like there's something that is above their shoulders.
The department hopes to avoid the virus infiltrating correctional centres. Visitation rights were earlier suspended, and it's not taking any chances. I'm going to ask my colleague Tulo Monare just to come this direction very quickly. You'll see we'll give you an idea of exactly what's taking place here. This is part of the quarantine area that has been set aside at the Johannesburg prison. You'd see there some tissue paper together with some soap. This is basically what it looks like here. I'll give you a sense. There's quite a number of these rooms here at the moment. The audio-visual remand system limits movements to courts.
We have those, as we have said, 46 of them throughout the country linked to the various courts. Those centers are aimed to ensure that at least they don't move around unnecessarily from here. This one here in Sun City is linked to the Johannesburg Magistrate Court. It is also linked to the Soweto Protean Land Magistrate Court, the Randburg, Wynberg, Orlando, and Hillbrow. Sometimes when these facilities fail, we also request the presiding officers to come here or to go to the centers to help us to postpone so that we minimize these unnecessary movements of the offenders.
The Health Department says it's pleased with interventions at the East London Correctional Facility, where a woman warder tested positive. Health authorities say correctional facilities are a must-watch.
Correctional services is one of the major high-risk areas. As you have mentioned, the kind of population in terms of inmates, upwards of 160,000, all confined in a particular space. So it just needs a small spark if something can be missed, whether from a staff member or an inmate who can bring in the disease that can cause a lot of problems.
Similar measures are in place at remand detention facilities in the country. Criselda Lewis, SABC News at the Johannesburg Correctional Centre.